the ones with chronic illnesses, slight IQ loss, that isn't really considered a problem, but they're not as intelligent or able to connect. They may be emotionally distant, which is just a mild form of damage. This may become, again, a majority of our Americans. Not quite right, but not bad enough to be hospitalized or institutionalized. Again, this is our new definition of normal. As a medical historian, Dr. Cutler also looks at the research from a perspective of a historian and connects the dots in ways others do not. A major cause of the Roman Empire's decline after 6 centuries of world dominance was its replacement of stone aqueducts by lead pipes for the transportation and supply of drinking water. Roman engineers, they were the best in the world, turned their fellow citizens into neurological cripples. Today, our own, who have our best and brightest with the best of intentions, achieve the same end through childhood vaccination programs, yielding hyperactivity, learning disabilities, autism, appetite disorders, and even impulsive violence. In addition to using lead pipes for transporting their drinking water, they used to also take lead to sweeten their wine. So I just thought that was a neat factoid there. So again, question, are vaccines effective? What does effective mean? The CDC terms effective meaning antibodies are produced, not necessarily clinical effectiveness meaning no disease. However, there's no correlation between antibodies and the resistance to disease, which means somebody with high antibodies can still get the disease and somebody with low antibodies may not get sick. However, the CDC is looking at these antibody numbers. Let's talk about the effectiveness that is seen here, done by a study from the Journal of the American Medical Association. Pertussis infections are common in an immunized population, more prevalent than previously documented. 81% were vaccinated in this population, and they still received whooping cough or got whooping cough. Outbreaks have occurred in 100% vaccinated populations, according to the Morbidity and Mortality Weekly Report. 80% of cases of measles are contracted in vaccinated people. Once again, I ask, how effective are these vaccines when 100% vaccinated populations are getting these diseases? Look at this. The increase in pertussis incidence was higher among vaccinated than non-vaccinated persons of all ages. You want to increase your chances, your child's chances of getting whooping cough? Vaccinate them. More pertussis since vaccination. With mandatory vaccination and 5 doses of the DPT vaccine, which is pertussis, pertussis occurs at a far higher rate now than before the vaccine was even introduced. There is a substantial underreporting of pertussis, including hospitalizations. There's more pertussis now than before the vaccine, as well as increased death in infants. Some vaccine, once again, why do we still give it? Doctors refuse to admit mistakes. The rate of pertussis was declining consistently until 1978, when the DPT vaccine was mandated for school entry in 41 states. The decline immediately slowed and began to rise again, and it has been rising ever since. Here's another finding showing that vaccines are not effective. An outbreak in 137 cases of measles, almost 99% of those students were appropriately vaccinated. Mass vaccination is promoted because of the concept of herd immunity. Herd immunity was developed by A.W. Hendrich in 1933, who said when 68% of children under 15 were immune to measles, epidemics did not occur. But his research was based on natural immunity, which lasts a lifetime, not artificial immunity, which does not. The American Medical Association encourages and supports childhood vaccination requirements because of this concept. But as you can see, how can herd immunity work if epidemics are still occurring in 90% and 100% vaccinated population? Another serious problem with vaccination is that it interferes with transplacental immunity. Girls who are vaccinated have less protection to pass on to their unborn child. More measles now occur in children less than 1 in adults that are older than 25. When a girl is vaccinated, she does not develop that natural immunity, and years later when she gets pregnant, she's not able to give her unborn child as much protection through the placenta, so her newborn baby may be born vulnerable to these diseases, such as measles and whooping cough and other diseases right at birth. And among newborns, again, these diseases can be fatal. Because of interference in transplacental immunity, we're seeing headlines such as this: whooping cough deaths increase despite all the vaccinations. The number of infants dying from whooping cough is rising despite the record high vaccination levels. All the deaths in the year 2000 occurred among infants under the age of 4 months. If you remember, whooping cough or pertussis was supposed to happen when they're 2. When they're 2 years old, they're more than likely able to survive past this, but not a 4-month-old. Since the early 1980s, reported pertussis incidence has increased cyclically, with peaks occurring every 3 to 4 years. As I said, that's why it's on the rise right now. It's going to happen every 3 to 4 years, whether you're vaccinated or not. So once again, I ask, how effective are these vaccines? Vaccinating for one thing may cause something even worse. Rubella, German measles, was so mild it was often mistaken as a cold. If you contract it during the first trimester of pregnancy, again, it may cause birth defects, which is noted as the congenital rubella syndrome. We have traded rubella, which is usually a mild disease and often mistaken for a cold, for congenital rubella syndrome, which can be deadly to a fetus. Congenital rubella syndrome, after vaccination began, it increased 600% to 77 cases a year. In 1992, congenital rubella syndrome cases dropped to 11, which was the exact same number as in 1966 before the vaccine was introduced. I want to note here that it is significant to consider the role that the declining stigmas against abortion had on CRS. It was more likely if someone knew that their child had CRS, they were going to abort the baby. And this is because all the cases of those 11 babies that were born with CRS were from Catholic Hispanic women, where they were more likely not to get the abortion. Outbreaks continue to occur in adolescents and young women despite the massive childhood vaccinations. Apart from the lack of protection, the vaccines cause a lot of sicknesses and disease. This is a survey done by the UK, conducted by a law firm who was engaged in a class action lawsuit representing thousands of families of children injured by the measles shot, after the government promoted the measles campaign. Now keep in mind, these conditions have been associated with other vaccines as well. I'm not going to name them all, just a few. Seizures, ulcerative colitis, bowel disease, Crohn's disease, headaches, rash, autism, arthritis, chronic fatigue, diabetes, multiple sclerosis, and death. You guys suffering from any of these? Were you vaccinated? That might be a reason why. Another useless vaccine is the Hep B vaccine. Hep B is a disease usually found in prostitutes and IV drug users. Why do we give this shot to babies? I kind of already went over that. The condition is practically unknown in U.S. children, and even so, all children who get it, most of them recover completely. The risks of a serious vaccine reaction may be 100 times greater than the risk of Hep B. Asthma and diabetes, autism and attention deficit hyperactivity disorder have increased greatly since the introduction of many new vaccines. In this one, because a lot of people say, oh, it was just the Hep B, they just got the Hep B. This is the one, again, that is given right when they're 2 hours old. This is the one that I think starts that slippery slope. And I'll prove why later. The number of injuries and deaths from the hepatitis B vaccine are 20 times greater than that from the actual disease. Hepatitis B vaccine is linked to lupus and multiple sclerosis. On March 27th in 2001, Judy Converse, she testified before Massachusetts House of Representatives committee. She stated the following: the Hep B virus infection is not a childhood disease. Most need a booster after 7 years. And once again, what 0 to 7-year-olds do you know who are doing drugs or having sex? No agency, the CDC included, lists infants or children among those people at risk. So I feel that this vaccine makes as much sense as taking an aspirin on Monday for a hangover that you may have on Friday. It doesn't make any sense. Another note saying that vaccines may be worse than the disease, or that they are trying to prevent the Hib vaccine, has been known to cause type 1 diabetes. Reports of death from the Hib infection after the Hib vaccination. The potential risk of the vaccine exceeds its potential benefit. And this was from the British Medical Journal. Prevnar increases infections. The Prevnar vaccine is given to kill some bacteria, but actually increases the number of other infections that babies get. This vaccine also has been known to cause diabetes. Again, we ask the question, are we vaccinating our children so that they're healthier? Are we just trying to kill bugs while harming our children? According to the American Academy of Pediatrics, this vaccine was the most retrogenic vaccine out there. It caused ER visits, seizures, deaths, and SIDS. Yet, they're still using it today.
Are they? What's it for?
It's a combination of 7, it's just to prevent infection, because
Oh.
your child might get an infection. Alright, chickenpox is a mild self-limiting disease that gives permanent lifelong immunity if caught as a child, but is much more dangerous in adults. Again, 30 times as more risk that they will die if caught as an adult. The chances of a child becoming seriously ill and dying from the chickenpox are about equivalent to winning the lottery. However, in my town, we did have a child pass from it. I want to note, though, on the vaccine, this is the only shot that was produced for economic reasons. It was estimated that the economy lost about $125 million a year because the moms had to stay home and take care of the child who had the chickenpox. So that is the only reason why this chickenpox vaccine was developed. It is, again, now these kids are starting to get shingles, which is a derivative from that herpes zoster that stays in their body. I don't know about you guys, no offense, am I offending anybody? I thought shingles was an old person disease. Nobody ever gets this as a child. Now we're seeing children with shingles, but they got a shingles vaccine, so don't worry. All right, tetanus, associated with improper wound cleaning, malnutrition, and a weak immune system, decreased 92% from the mid-1850s to the early 1900s before vaccination. U.S. cases from 1990 to 1999, about 470 of them, 70 resulted in deaths. Most occur in those over 50. 95% of their fatalities actually occur in that age. 5% of the tetanus occurs in people under 20. Fatalities are extremely rare under children, in younger children. There are between 50 and 130 cases of tetanus each year. It appears to be most dangerous in the elderly. Once again, almost all fatalities are with intravenous drug users or diabetics that are over the age of 30. Again, I ask, why are we injecting children with this, especially when you need a booster every 10 years?
So what about an adult who, like when we went to Africa, you had to have it?
Okay, I don't know why.
I guess if you choose to travel.
Tetanus, it can only, I've researched, I could be wrong, it can only be found from like pig fecal matter. So that's where I don't know why they would do that.
Seems like when you're in ER, you know, if you get an injury, they ask when your last tetanus was. And
Yep.
can you refuse it?
Oh, absolutely.
Okay, see?
Absolutely.
I just-
Yep, and I'm getting on, yeah. So basically, the tetanus vaccine reactions include, I'm asking, why give children to this, and especially when it can cause Guillain-Barré syndrome, brachial neuritis, which is basically numbness and tingling down the arms, demyelinating diseases such as MS, arthritis, joint inflammation, anaphylactic shock, asthma, allergy, and others. It's very, very rare that you're going to die from tetanus. People often ask, what about polio? We're going to get to this one. We're going to take just a short break. So polio is next to come, autism's next to come. As I said, that first part was drier, the second part does kick up. So you guys have about 5 minutes. Go take a break.
That's great. But I'm sitting here going, okay, if I show all this to Heather, it'll just make her more, you know, and then there's one, he probably has, most of the kids are vaccinated.
You guys gonna go to the bathroom or no?
Yeah.
Okay.
You know, you get a little paranoid.